Welcome to the Back on Track Achieving Healthy Weight Loss podcast. I'm your host, Dr. Alicia Shelly. A recent poll noted that 42% of working moms have some type of depression and or anxiety. 42%. This is such a high number, especially when the general population, it's at 28% for having depression and anxiety. So that's almost double. And not only does depression and anxiety can be worsened by external stressors, having extra stress can lead to increased cortisol levels and weight gain. So today we are going to talk all about how we can reduce our stress with self-care. And I have expert Dr. Magda Bajet. She is a dedicated board-certified family medicine physician with a deep commitment to public health and mentorship. She enjoys engaging with high-achieving professionals who need help getting back the feeling of joy in their careers and lives. As a professional speaker, she specializes in topics like self-care, wellness, public health, and embracing joy in your life. And she's also the host of the YouTube channel at Doc Majet, where she talks all about joy. So if you haven't checked her out, definitely check her out. So welcome to the podcast, Dr. Majet. We're so happy to have you.
Thank you so much, Dr. Shelly. It's such a pleasure to be here. And thank you for that introduction. Thank you so much.
Oh, you're very welcome. I'm glad that we're going to have an opportunity to learn about how we can decrease our stress, how we can have more self-care in our lives. Because the one question I ask all my patients on that initial visit is, what do you do to relax? What is your stress level? And there's no wrong answer of what it is that people do to relax. The only wrong answer is that there's nothing. Like there's silence when I ask. Like it's just not good at all. Because we want you to have that outlet. But before we get into self-care, please tell us a little bit more about yourself and how did you get into this space of self-care and joy?
Well, I'll tell you a shorter version, but of course, in our lives, many things happen that determine where we get to as far as like our purpose and our careers. But for me, as a family physician, and especially caring for underserved populations, so in Miami, I trained at a public hospital, Jackson Memorial Hospital, care for a lot of underserved populations, and then I specialized in HIV primary care as well. So what I had to learn on my own was that my self-care was also so important. Because when you're taking care of a lot of people and you're taking on your stress, but also their stress as their provider, when you do have a lot of empathy for your patients and colleagues that are suffering through numerous medical conditions, you can sometimes get to a point where you have difficulty caring for yourself because you feel like they need it more than you because they have a condition or, that much more severe than what you personally are dealing with, but you still have to learn and take care for yourself. I learned that in a challenging way during the pandemic that I need to take time to care for myself truly. And it's not just getting my hair done or getting my nails done. It's taking that time to really treat myself well, speak to myself kindly, think about things that I enjoy and incorporate that into my life, spend time with people that I'm able to, not be stressed with, or people that are supportive, like my support system, my support system, and just rejuvenate. So I was able to rejuvenate and get to a much better place. And I thought, why was I functioning that way before? Because you don't realize when you're deep in neglecting yourself, you may not realize how important taking that time to care for yourself and manage your stress.
I agree. Sometimes it's so difficult when you're in that moment because you feel like you need to do other stuff. Like people are asking, for your, your attention. You may have family members, you may have work obligations, and it makes it so hard at times to kind of like put yourself first. And then of course there's some guilt. Well, why do you feel like you've gone through this journey here, especially a journey where you, like you said, I forgot myself, I need to incorporate more self-care. Why do you feel like it's important for people to incorporate that self-care in their wellness journey?
Well, it's so important because we don't care for ourselves just so that we care for others, right? we have to care for ourselves because we're blessed with a body, and honor the body in our time here on earth that we have, right? Mm-hmm. Rather than just to neglect ourselves and run it down. So it's not just that we care for others, but we need to appreciate ourselves and all that we are.
That's true. It is a sign of appreciation. And you're also right. We don't have much time on this earth, so we need to enjoy the time that we have and make sure that we are doing things that we enjoy. That's true. Why do you feel like why people neglect themselves? Or why do you feel like that becomes such a challenge for people?
I think it's so many reasons. Of course, everyone has their own personal reasons why they may have gotten to that point. But ultimately, I think it comes down to feeling thoughts like negative thoughts of guilt, shame, or blame in regards to like, oh, negative thoughts like I don't deserve to take care of myself, or oh, I'm only useful if I'm doing something for someone else, or this type of thinking is just pervasive. I don't know exactly where it comes from. Maybe as women, you mentioned mothers. So mothers have a lot of guilt that they need to put their families before themselves. So that's part of that guilt. And if they do take time for themselves, they may feel that, oh, this is time that's going away from my child. If I take, a long bath, maybe 30-minute bath, that's time away from my child, even though my child can be with her dad or whoever that is. People feel guilty for taking that time for themselves. So that sensation of guilt can be pervasive in many different ways.
Yeah, so I definitely see how guilt can kind of play a role on how we kind of avoid that self-care. Now, you mentioned that there are different ways that people can incorporate self-care. You said it's more than just getting your hair done and nails done. So tell us, how should somebody be incorporating self-care, and what does that mean?
Okay, so incorporate self-care. There's some very simple things that you can start to incorporate into your self-care. One of those, like before we go into all of the detail, I wanted to mention first, notice if you're stressed, right? So sometimes we don't notice when we're stressed, and it can become to the point where you're severely stressed. So just take time to notice, like, are most of my thoughts stressful? Oh, am I feeling like that things are not going to go well, even if I don't have evidence that that's the case, that you are catastrophizing, thinking that, oh, nothing's going to go well, but you don't have evidence that anything has gone wrong, or you are doing so many things that you feel like you're on a hamster wheel. Like take time to notice like where you are and what you are thinking. And if you are feeling severely stressed, you may need professional help, because that can, of course, lead to anxiety and depression. Minor stress, or just, you feel like, okay, I have some stressful things going on, but I'm managing to cope on my own. You can start with simple things like deep breathing. Every time that you feel your heart rate goes up, or you feel like you may have some type of trigger that you want to react to. Say someone says something wrong to you, or you feel offended, right? So something like that could happen. You're already stressed, and someone says, says something, and you don't take it the right way. Take a time before you respond, take some time, take some deep breath. There's a lot of great breathing exercises. One is diaphragmatic breathing. That helps me a lot. So it's taking one hand to your chest and one hand to your belly, and then just keep breathing in. And you can feel your diaphragm, which is, your lower abdomen, just extend, and just take a few times to just do that to bring your heart. You can feel your heart rate come down, and try to move your mind not to what's happening, but to your breath. Like, okay, so I'm just going to focus on my breath right now. Or if anything feels too stressful, of course, not when you're driving, just take your mind back to your breath. Like, wait, I'm breathing kind of fast. Let me just calm down and take some few deep breaths, and then maybe maybe that will give me some time to be more creative and come up with a solution or get help if I need to, instead of being reactive. So just breathing exercises is a great part of self-care. Number 2, I would say, is how we speak to ourselves. When something goes wrong, like, I used to do this a lot. Like, say, even I drop something. Oh, goodness, I'm so clumsy. Oh, good. I am, don't say negative things about yourself. And people do it all the time. Like, oh, I'm bad at this, or I'm horrible at this, or excuse me, I'm always late to turn this in. I'm sorry, that's just me. Don't say that that's just you, because it's not, right? So that is also speaking negatively about yourself. So when you notice yourself doing that, just say, no, everybody drops things sometimes. I dropped this one time does not define who I am, right? Well, taking that time to examine, like, how am I talking to yourself? Be your own best friend. If you notice that you are sitting there dwelling in negativity about yourself, like, oh, I didn't do anything right today. I did this wrong, that wrong, this wrong. Imagine that your voice, that negative voice of you criticizing yourself, was you criticizing someone you love, right? Your best friend, your grandma. Like, would you let someone talk to her that way?
Yeah. No point. We wouldn't. Not at all.
You would be ready to fight, right? So so be that vigilant about yourself and about how you talk to yourself. So that would be number 2. Like, be very vigilant about how you speak to yourself. Speak to yourself with kindness. And then don't beat yourself up if you don't speak with yourself with kindness some days, because you're like, oh no, I wasn't kind to myself today. No. So don't.
Like, this is cycle.
Right? So it can happen that way too. So just be kind and graceful with yourself. Today I did my best, and today I improved from yesterday, and that's okay. I have another day to go. And over time, the more you practice it, you will feel so much better about yourself. You'll feel so much less stress, and you'll have much less guilt and shame about taking care of yourself, because you will feel more worthy of being cared for. The better you speak of yourself, the more worthy you'll feel.
I like that. So the better you speak of yourself, the more worthy you'll feel. So if you guys missed it, let me just go through it. So the first one is to focus on deep breathing. Try the diaphragmatic breathing techniques, where you put one hand on your heart, one hand on your stomach, and take a deep breath. And then number 2 is stay positive. Avoid negative comments about yourself. Number 3, be your own best friend. Recognize how you talk to yourself. Ask yourself, would I talk to a friend like how I'm talking to myself? And if the answer is no, then you need to change. And then also make sure to speak to yourself with kindness. And then last but not least, give yourself grace, which is so important. Now, how often should you be incorporating these strategies in your daily activity? Is it a daily thing, weekly thing, monthly thing? How often should you be incorporating these strategies?
As much as possible. This is multiple times a day. This is like from when you wake up in the morning to you go to bed, throughout your day. If there's a break at work, it could be when you are all throughout the day. So this is just incorporate it. If you have to incorporate it every few minutes, just incorporate it throughout the day. And it doesn't stop. So this is something that just because you did it one day, you're cured and you don't have to do it again. This is something that you have to keep doing and create it as a lifestyle. The speaking negatively about yourself, the reactivity, all of those things were a habit, and you do that throughout the day. Well, now it's best to change and incorporate the positive self-talk, the calm nature, the deep breathing, and incorporate that throughout the day. And it only takes a few seconds, right? It only takes a few seconds to interrupt the thought patterns, but just incorporate it throughout the day as much as possible.
Now, let's say, what would be your advice for somebody who may not necessarily have a self-care routine or can't quite pinpoint it, and they definitely need to start it? Like, how would you advise them to kind of get started?
Yeah, so of course, we talked about like a few key ways to do self-care, but it can be different for everyone about how they want to incorporate. Like, your self-care could be going for a walk, could be exercise. You know, it could be, you know, making sure you have your doctor's appointment. That's self-care as well. So of course it's not as frequent, but incorporating that as part of self-care. So what I would recommend for that person just getting started is pick 3 things. So we talked about the self-talk. That could be one. And so one thing, pick 3 things or write them down and try to incorporate that into your day. Like today I'm going to practice positive self-talk. And when I catch myself saying like, oh darn, there you go again, dropping stuff. You always drop stuff. I'm going to say, no, I don't always drop stuff. I just happen to drop that one item and I can easily pick it up, and I'm not going to beat myself up over something so simple as dropping something, which everyone does, right? So taking time to address those in the moment. So that's something simple you can incorporate. So once you decide which key, and these are all free. These are all free, by the way. Very free. Yeah. Yes.
Yes, true. All free that you can do.
And you don't need any special equipment. You don't need to do any, particular. It's just taking the time to say, look, I'm going to start trying to take better care of myself. Make that decision and start with 3 things and just go from there. And it doesn't have to be that you did it 100% in the day. You just did it more than you did previous. And that's okay.
You got to start somewhere. Well, how can somebody work with you, or how can they reach you if they have more questions?
So you can reach me. I have Instagram. My Instagram is at DocMajette, DocMajette. I have a YouTube page, which is at DocMajette, DocMajette. I have an upcoming podcast called Embracing Joy. It is not released yet, but I have some live episodes, and then the recorded episodes will be coming out soon. And those are the main areas where you can reach me. You can find me on LinkedIn, Dr. Majette on LinkedIn, and those are the main. I'm also on Facebook. Oh, goodness, you can find me everywhere.
You're everywhere, which is a good sign.
So you can find me there as well. And this was such a pleasure, Dr. Shelly.
Yeah. Thank you. No, thank you. Thank you so much for coming in and sharing your knowledge, your strategies, and how we can take better care of ourselves. So not only are we trying to be more healthy, but we need to be well-rounded with having a emotional spirit as well, and being able to incorporate that self-care for us. So thank you again for joining us, and thank you all for joining the Back on Track Achieving Healthy Weight Loss podcast. If you like this episode, please feel free to share it with others, like it and subscribe, and don't forget to leave a 5-star review. And we'll see you back next week.
Bye.